Question 5. A 35-year-old man is brought to emergency room after suffering a catastrophic fall while skiing during a training session. He was found unconscious by aeromedical emergency service team who established an airway and spinal control measures. Upon arrival at emergency department, ventilatory support is started, followed by evaluation of patient by neurosurgical team. His blood pressure is 200 by 125, heart rate is 55, respiration is 15 with kind stroke breathing. Neurological examination shows a Glasgow Coma Scale of 4 by 15 with a dilated fixed pupil and decerebrate position. MRI shows diffuse axonal injury of brain with severe cerebral edema, multiple frontal and occipital lobe contusion, and multiple flame-shaped hemorrhages in the brainstem. Despite medical team efforts, the patient dies in 24 hours. Which of the following type of herniation is most likely found in this patient's autopsy? Uncal herniation, subfalcine herniation, central herniation, downward cerebellar herniation, or upward cerebellar herniation. Okay, now in this question, they're asking that this patient had some spinal injury and stuff like that. And after that, what happened is that he developed dilated fixed pupil and decerebrate position. MRI showed cerebral edema and multiple flame-shaped hemorrhage in the brainstem. Which of the following herniation is found in this patient? So there are different kind of brain herniation. Basically, whenever you increase the pressure in your brain, let's say due to cerebral edema, the skull is a very compact and it cannot and a very fixed compartment. It cannot increase its volume. So if you increase the pressure of the brain matter, the brain will start herniating somewhere. The brain will start moving somewhere. It cannot, the skull cannot expand itself. So when this movement occurs, it is known as herniation. Herniation can be of different type. It can be cingulate, it can be central, it can be whatever. There are multiple types. Now they are asking what is the type of herniation that has occurred in this patient. So this patient, after developing cerebral edema, kind of developed, what did he develop? He developed dilated fixed pupils, both the dilated fixed pupil, decerebrate posture, and diffuse axonal injuries with multiple flame-shaped brainstem hemorrhage. So all these findings are very specific of central herniation. Central herniation means that some part of central brain and central part of both temporal lobe goes down into the brainstem area. When that happens, the brainstem also gets some kind of retractory pressure, and there are hemorrhages which are very specific, specifically known as flame-shaped hemorrhages, and they are found only in central herniation. So this multiple flame-shaped hemorrhages in brainstems are also known as Durette. Yeah, so this, if you can see, not sure if you can see this whitish line in the brainstem, which is indicative of hemorrhage. So there can be multiple of them. This is a very clear indication of one of them, which is quite big. So that is known as Durette hemorrhage. So whenever you see multiple flame-shaped hemorrhage in the brainstem after cerebral herniation, you should directly think of central herniation. That is very specific to central herniation. Okay, so this is central herniation. Okay, so Kumar is asking, upper motor neuron lesion is when lesion are above the level of spinal cord, right? So when spinal cord is involved, shouldn't it be lower motor neuron and have a negative plantar extension? Okay. I think there's some kind of confusion going on, so let me clarify that for you. Okay, I need to make a better drawing this time, I think. Okay, let's do one thing. Let's try to discuss this at the end of the session. I got your question, Kumar. We have very limited time for this session, but at the end, I can surely discuss this with you. Let me move ahead to the next question. And If you have any question with regard to this one as well, you can put in the chat box.
Thanks for watching. Please give a thumbs up and subscribe for more.